Hi, my name is Dustin. I'm a respiratory therapist and a respiratory coach. And today I'm going to give you a guest seat in a conversation I've had with a patient. So like most patients, I usually ask them, what's your smoking history? And one of them said, I don't smoke cigarettes, but I smoke weed. And my doctor told me to stop smoking weed, but what am I going to do about my pain and my anxiety? And why should I quit? So that's what we're going to jump into today. So I'm going to present this with no judgment, but give you a clear perspective of what your body's doing when it responds to chemicals like these. Smoking in general affects your lungs. So what your doctor is concerned about is how it affects you. It's not about your fear of you dying or you doing anything bad through shame. Smoking affects your lungs, and this is what it does. When we breathe harsh chemicals, it's exactly what our lungs don't need. What we need is warm, clean, humidified air. What these particles do is irritate our lungs. When we're using anything that is combusted or vaporized, that is not good for our lungs, we don't do well with it. That's including vape. And cleaning products I'll throw in there as well, because these are aerosolized synthetic chemicals that are not good for us, and they irritate our lungs. What they're doing is that these particles go into our lungs and they irritate the air lining. And that irritation sends out a signal to your goblet cells to produce more mucus and to send helper T cells to the area to fight this infection. So blood's going to the surface of your tissue. It's sending out immune responses, which then sends out this mucus to capture whatever is irritating it. And that leads to mucus buildup and a cough. And then to move all that stuff up, you have these cilia fibers which are doing it. But if they keep getting irritated over and over and over again, it's like moving a mountain. It keeps moving, and it's just the more it gets, the more harder it is to get. So what you notice is in the morning when you're not smoking is you have this really nice cough and you're good for the rest of the day. That's because your body stopped finally smoking and the cilia can move now, and now it's coming up. Any irritating chemical or smoke specifically can lead to the cilia not moving, and your cough gets more and more irritated over time. So what's happening is this, even though you're not noticing symptoms, it's affecting you over the years. They call this the silent killer or the silent inflammation. We're not going to kill you from smoking weed or you smoking cigarettes. But what we're doing is adding inflammation that your body does not want. And over time, it's going to make it harder and harder for you to absorb oxygen. Now, tobacco is our most number one toxin in smoking arena. But anything else, like weed specifically, is not a very good irritant. The difference with weed is it's the way it's used as well. When we smoke weed, it's typically a longer joint, which goes not just in the upper part of our lungs, but the lower part of the lungs. And it's burned at higher temperatures, which is causing more inflammation and irritation in your lungs. So yes, it is not smoking cigarettes, but it's still causing harm in its own way. It will also cause this increased irritation, not just up here, but down lower. And so you're developing an overall lung irritation deficiency you don't want over time. So we're not saying the typical, hey, don't smoke because it's bad for you, which is shame, or saying your lungs are paying the price is exactly what it's saying. It's not about you doing a bad thing. It's that you're being exposed to stuff that your body's saying, I don't need this. Because what we want is warm, clean air. That's what we want. And what's happening over time is what doctors term chronic bronchitis. Bronchitis is inflammation in the bronchial tree. We have the bronchial tree and the alveoli, which are the sponges that absorb oxygen. So your bronchial tree gets inflamed, which causes a bronchitis, which is bronchial inflammation, which can lead to wheezing and chest tightness, And then reduced tolerance for exercise because of this inflammation is not allowing you to get in enough air. And oxygen is very important for cellular energy. And also, it also affects your ability to respond well to immune responses. So you're more prone to getting sick, yes, but also staying sick. So this inflammation, this long-term exposed inflammation, can lead to that inability of your body to heal quicker. That's what we want, is to heal quicker. We're all going to respond to an immune response to an irritant or an outside environment, but we want to heal quicker. So now we're going to deal with, what do I deal with when it comes to my pain and my anxiety? We all deal with this. We are all part of this life. We have to experience coping with pain and anxiety. Now, pain has many different sources, but the number one way to treat it is by breathing exercises. We use meditation or mind control breathing, where we breathe in and out our nose, very slow and deep. What this does is reset the nervous system and increase production of your high, happy hormones that we want, that help us be able to cope with stress. Our serotonin, even some of our dopamine receptors get involved to help us be able to reset our nervous system. Hyperventilation increases pain. Another thing we can do is recognize if we are not getting enough sleep. That will produce the most pain in our life, is not having enough sleep, as well as connection with quality people. People that are promoting you have natural pain relief. If you have friends that say, don't worry about eating, don't worry about anything else, just smoke, these are not the kind of friends that want you to actually get to the source of the problem just to avoid it. When we avoid our body, it ends up giving side effects over time. And the more we ignore it, the worse they get. So listen to your body, listen to your mind, listen to your heart. You know what's right. Another thing that your body might be deficient in is nutrients. When our body has a lot of inflammation over time, we need nutrients. That specifically nutrients is D3, magnesium glycinate. We need vitamin E, omega-3s, and we can throw in some zinc for extra support. And then your B12 vitamins and your folates. These are things that your body needs to help reabsorb and heal itself. It's just getting tired over the time. So let's make it easier for it to recover and feel more at ease. So we're not here to demonize your use of cannabis. We want to help you get alternative options that are lung safe. So if you actually find successful benefits from cannabis, you can get the same effects from using it in a different way. They do make tablets or chewables. You can even get it sublingual, which is under the tongue, or even topical creams. So don't narrow yourself into thinking I only can use smoking as a way to receive health benefits. Let's help your overall inflammation by going to another route. Because we want you to heal from the inside out. The goal is that you know that you have control of your pain and anxiety through your breathing, your sleep, your connection, and proper nutrients. And that the reason why we don't want to use any type of smoking product is to help our lungs stay at ease, decreasing inflammation, decreasing irritants, and allowing your body to heal naturally and boost its own immune response to natural things in the environment. We have enough toxins to deal with. Let's just make it easier for your lungs. Now, it is an honor to help you recognize that smoking is not a deficiency of the mind, because you were not born to smoke. You're born to be who you are and breathe clean, warm air, humidified air as well. You need this to breathe, to be at ease. And I want you to go away with this remembering that you have control, and you can choose today over the next 3 months, not 6, 3 months, to cut back and improve your breathing. It is an honor to put health back in your hands. And thank you, and God bless.